We know that 1 in 8 women will get breast cancer. We know that thousands die from it each year. We know that millions are raised for research and treatment. But do we know the basics about breast cancer? The most common type, if every lump is the same, and if every woman's cancer is the same? Well, we will after this edition of It's Your Call, where the region's leading breast surgeons provide a breast cancer tutorial, and it all happens right now on It's Your Call. All right, pull up a chair, get out a pencil, and start taking notes because we are conducting a breast cancer tutorial for you this hour. Hello, everyone. It's great to have you along with us. I'm Lynn Doyle with another in our continuing series on breast cancer. Today, we're focusing on the very basics of information, like, is there a most common type of breast cancer? Is there an across-the-board diagnosis, or is each case truly an individual one? And when and if you are diagnosed with breast cancer, is radiation, chemo, and a mastectomy automatically part of your future? Essentially, we are going to be conducting a breast cancer tutorial to answer any question that you might have. If you do have questions, start emailing me right now at lynn@lynndoyle.net. I am very pleased to tell you that we have been given access to 2 of the region's top breast surgeons. They are both from Holy Redeemer Hospital's Breast Health Program. Let me introduce them to you. Dr. Catherine Carruthers is a fellow of the American College of Surgeons and a fellowship-trained breast surgeon. And Dr. Stacy Kreischer is also a fellow of the American College of Surgeons and has been a practicing surgeon for 10 years. Doctors, thank you very much for being with us. I certainly appreciate it.
Thank you.
I'm calling this kind of a breast cancer for dummies, and I don't mean that to be in any way negative, but kind of taking off on the book where I try to make it as simple as possible for people. So my very first question is there one particular kind of breast cancer that women get, one that's more common in women than another?
Well, the most common type of breast cancer is invasive ductal cancer. It's commonly diagnosed in probably about 85% of women who are diagnosed with breast cancer. So that would be the one most common breast cancer that we see in our patients.
So what does that mean if you are in fact diagnosed with that?
Well, invasive ductal cancer is basically a cancer that starts in the ducts of the breast. And invasive ductal cancer then, once it's started within the duct, it expands out of the duct into the fatty tissue of the breast. Once breast cancer is expanded and spread into the fatty tissue, it has a potential ability to spread to other parts of the body, which is what makes it so serious.
Now, if women are most frequently diagnosed with this, does that mean that it's easier to find?
Well, it depends on the woman's breast. Mammography is a great screening tool that we use, and in women with fatty density on their breast tissue, usually these are fairly easy to find. However, the more density that we see in the breast tissue, the more difficult the screening becomes. These are usually easier to see on mammography than the other type of breast cancer that is the other more common type that we diagnose, which is lobular cancer of the breast, or invasive lobular cancer. That becomes a little harder to see on mammography.
Okay, so if you hear those words, the duct and the invasive and the carcinoma and all that, I mean, what's the initial reaction as surgeons when you see that? Do you think, oh my, this is a deadly case, or do you say, oh my, this is something we've caught early?
Well, they're all different. So an invasive ductal cancer comes in many different forms. So that's just the type of cancer, the cell type that it arises from. But there's different grades that go into making a diagnosis. So there's low grade, which tends to be a slower growing cancer, or there's intermediate grade, but also high grade, which tends to be a faster growing cancer. So you can't just look at that pathology and kind of make a decision on how aggressive it is. We really need a lot of other inputs from the pathologist.
Okay, so this is where it's a common type of breast cancer, but each individual woman's case needs to be reviewed for specific characteristics.
Right. Not only do we review for characteristics like the grade of the cancer, we review for characteristics such as hormone status. So we see whether cancers are reacting to the female hormones, the estrogen and progesterone that we all have in our body. We also always look at the stage of the cancer. So the grade tells us how aggressive, how fast growing the cells are, but the stage tells us more how how large the tumor is, whether it's spread into lymph nodes, whether it's spread to other organs, and that gives us a lot of information about the cure rate of cancer.
So let's talk about those stages if we can, because I know people at home are accustomed to hearing stage 1, stage 3, stage 4, and you tend to have a visceral reaction when you hear stage 1 as opposed to stage 4. Stage 4, I think people just automatically assume, well, that's end stage. So can you clarify for us what those various stages are?
Well, there's some subgroups into that, but stage 1 means most of the time it's a much smaller tumor, and there's no spread to the lymph nodes. Stage 2 is still a smaller tumor that may have less than 4 lymph nodes involved, or it may be an intermediate-sized tumor that has no lymph nodes involved. Once we get into stage 3, we're usually looking at a larger tumor with greater lymph node involvement or invasion into the chest wall of the skin, whereas stage 4 is really when the tumor has spread outside of the localized region of breast cancer into the bone, the liver, the lungs.
Right. So am I, like most women, when I hear that lymph nodes are involved, I assume that is more dangerous to a woman who's been diagnosed?
Yeah, because then we know that the disease has the potential to spread and grow elsewhere. But even if it is in the lymph nodes, it's still very curable, as long as it hasn't spread outside that area.
Right. Okay. And even stage 4 cancer, it's important to recognize that stage 4, while we do think that stage 4, it is obviously metastatic, we don't consider that we can cure stage 4, but we can manage stage 4 breast cancers with medications, and some women have very long-term survivals with stage 4 breast cancer.
It's interesting that you say that, because I'm already getting emails, and one of the emails is from a woman who has stage 4 breast cancer but has had it for 16 years, and she said that it is metastatic. And she said it's actually quite difficult after having it for such a long time, because people have a different empathy toward you than they might with someone who was just recently diagnosed. We're going to share her story in just a minute. But first, I want to invite our viewers to be part of our conversation. As always, we want to hear from you. If you have questions about breast cancer, whether you're trying to educate yourself just so that you know, just in case you hear those words, you have breast cancer, or perhaps someone in your life has been diagnosed. If you have questions, you can ask. If you have fears about the disease, you can tell us what they are. If you've had an experience that you want to share and perhaps use that experience to help others, we'd love to hear from you. As I said, you can email me directly at lynn@lynndoyle.net. As always, you can find us on Facebook, Twitter, and YouTube as well. We're going to be sharing some of our Facebook stories and questions in just a moment. So we've told you what the most common kind of breast cancer is and what the various stages are. Is there a secondary or other types of cancer that people might hear from?
Absolutely.
When they get a diagnosis?
Right. The second most common breast cancer that we see is probably invasive lobular cancer in the invasive spectrum. There are other cancers that are much more rare that I don't think there's not much reason to talk about them unless a patient is individually diagnosed with them, because there are other things that we see in the breast. There are even cancers in the breast that are not actually breast cancers. So we can see other types of cancer that arise in the breast.
Or spread to the breast.
Or that spread to the breast as well.
So we automatically assume that the cancer started in the breast, but sometimes it actually migrates to the breast because it started elsewhere.
That's very, very rarely do we see that, but occasionally we do see that.
Okay, that's good. We are going to next talk about what happens after you get that diagnosis and what the various forms of treatment are and what's changing in that. So if you have a question or a comment, as I said, please email me. We will take a short break, and when we come back, we'll share some of your stories and educate you a little bit more about breast cancer and what that diagnosis means to you.